Welcome to another episode from the Veterinary Research Channel. Today we delve into a fascinating and recently better understood condition affecting our feline companions, gastrointestinal eosinophilic sclerosing fibroplasia, often referred to as GESF. This condition manifests as masses within the gastrointestinal tract, the mesentery, which is the membrane supporting the intestines, and the abdominal lymph nodes. For veterinarians and cat owners alike, understanding this disease is crucial for accurate diagnosis and effective management. This episode will explore the latest findings on the clinical presentation, treatment approaches, and outcomes associated with this important differential diagnosis for abdominal masses in cats. In the past, these types of masses could be challenging to identify definitively and were often mistaken for other, sometimes more aggressive, conditions such as lymphoma, granulomas, fibrosarcomas, adenocarcinomas, and mast cell tumors. The microscopic examination of tissue samples, known as histopathology, can also present diagnostic hurdles. However, advancements in diagnostic techniques, such as immunohistochemical staining for a substance called transforming growth factor beta-1, can provide valuable assistance in reaching a correct diagnosis. While gastrointestinal eosinophilic sclerosing fibroplasia can affect cats of any breed, age, and sex, it appears to be more frequently observed in middle-aged and male cats. Notably, certain breeds seem to be overrepresented, including ragdolls, Maine Coons, Persians, exotic shorthairs, Bengals, and Scottish folds. This observation suggests a possible genetic component influencing susceptibility to the disease. However, the precise underlying mechanisms, or pathogenesis, of gastrointestinal eosinophilic sclerosing fibroplasia remain an area of active investigation. The clinical signs exhibited by cats with gastrointestinal eosinophilic sclerosing fibroplasia are often chronic and can include vomiting, diarrhea, weight loss, and lethargy. In some instances, the onset of vomiting and diarrhea may be more sudden. A significant finding upon physical examination is the presence of a palpable mass within the abdomen, reported in a high percentage of cases. While surgical removal of the mass has been a common approach, medical management using corticosteroids and other immunosuppressive medications has also been described. It's also been noted that in some cases, additional masses can develop even after the initial mass is surgically removed. The prognosis for cats with gastrointestinal eosinophilic sclerosing fibroplasia has varied in previous reports, and large-scale studies specifically examining prognosis and treatment response have been limited. Therefore, a recent study aimed to provide a more comprehensive understanding of this condition by retrospectively evaluating a large group of cats diagnosed with gastrointestinal eosinophilic sclerosing fibroplasia, examining their clinical presentation, diagnosis, treatment strategies, and overall outcomes. This extensive study reviewed the medical records of 60 client-owned cats that received a confirmed diagnosis of gastrointestinal eosinophilic sclerosing fibroplasia based on histopathological examination. These cases were collected from multiple veterinary hospitals across the United States, the United Kingdom, and Japan between the years 2010 and 2022. The researchers meticulously gathered data on the cat's breed, age, sex, the duration and nature of their clinical signs, findings from physical examinations, results of blood tests, imaging studies, surgical reports, and the medical treatments they received. The analysis of this substantial cohort of cats revealed several important insights into gastrointestinal eosinophilic sclerosing fibroplasia. The median age at diagnosis was approximately 5.5 years, with the majority of cats falling within an age range of 3 to nearly 9 years. Regarding breed predilections, domestic shorthair cats constituted 30% of the cases, and domestic longhair cats made up 12%. Notably, pedigree breeds were significantly represented, with ragdolls accounting for 25%, exotic shorthairs 10%, and Persians 8% of the cats in the study. Other breeds identified in smaller numbers included Maine Coons, Sacred Burmans, American Shorthairs, Bengals, Bobtails, and British Shorthairs. Interestingly, neutered males were more commonly affected, representing 57% of the cats, while spayed females comprised 42%. The duration of clinical signs prior to diagnosis varied, with a median of 90 days. Although some cats experienced signs for a much shorter or longer period. Most cats exhibited a combination of symptoms, with a median of 3 distinct clinical signs observed. The most frequent presenting complaints were weight loss, affecting 60% of the cats, followed by reduced appetite or complete loss of appetite in 55%. Chronic vomiting, lasting for more than 2 weeks, was reported in 37% of the cats, while lethargy was noted in 35% and chronic diarrhea in 27%. Less common signs included acute vomiting and diarrhea, constipation, straining to defecate, increased appetite, blood in the stool, decreased grooming, passage of black, tarry stools, and excessive grooming. Upon physical examination, the most common finding was a palpable abdominal mass, detected in 58% of the cats. Other less frequent findings included fever, dehydration, and abdominal pain. In over a quarter of the cats, their body condition was assessed as being less than ideal. Blood tests revealed that eosinophilia, an elevated number of eosinophils, a type of white blood cell, was present in 52% of the cats. Anemia, a low red blood cell count, was observed in 28% of the cats. Other less common blood abnormalities included increased numbers of neutrophils, monocytes, and lymphocytes, as well as a decrease in neutrophils and an increase in basophils, other types of white blood cells. Serum biochemistry analysis, which examines the levels of various substances in the blood, showed that low albumin levels were the most frequent abnormality, seen in 28% of cases. Elevated globulin levels were noted in 14%, low cholesterol in 10%, and low total calcium in 10% of the cats. Notably, serum cobalamin and folate levels, which can indicate intestinal malabsorption, were generally within normal limits, although some cats showed borderline or elevated levels. Abdominal imaging was performed in all cats. Ultrasound images were available for review in half of the cases. In the majority of these cases, the mass appeared to originate from the stomach or intestines. The characteristic ultrasound appearance included a loss of the normal layered structure of the intestinal wall, circumferential thickening, either symmetrical or asymmetrical, eccentric growth, and a mixed echogenicity with bright areas and potential ulceration. In some instances, the layering was altered rather than completely lost. Changes in the peritoneum, the lining of the abdominal cavity, were frequently observed, often appearing as a brightened, hyperechoic lining, and some cats had fluid accumulation within the abdomen. Importantly, no evidence of gastrointestinal perforation was detected on ultrasound. Enlarged lymph nodes within the abdomen were common, particularly the ileocholic, pancreaticoduodenal, and mesenteric lymph nodes. Examination of the location of the masses revealed that the small intestine was the most common site, affected in 32% of the cats, with the proximal duodenum being the most frequently involved part of the small intestine. The stomach was the second most common location, with 27% of cats having masses there. Other sites included the ileocholic junction, colon, lymph nodes, and mesentery. The majority of cats had a single mass, but 15% had masses in more than one location, often involving the mesentery and nearby lymph nodes. Interestingly, one cat was diagnosed with an eosinophilic skin mass concurrently with gastrointestinal eosinophilic sclerosing fibroplasia, a finding not previously reported. In a few cases, cats developed additional masses at different times and locations after the initial mass was removed. Cytological evaluation of fine needle aspirates from the masses revealed eosinophilic inflammation in less than half of the cases where it was performed. Cytology of abdominal lymph nodes was often non-diagnostic or showed only reactive changes, with eosinophils identified in a minority of samples. Surgical intervention, either for mass removal or biopsy, was performed in a significant proportion of the cats. Complete microscopic removal of the mass was achieved in most cases where surgery was performed for removal. In other cats, the diagnosis was obtained through surgical biopsies or endoscopic biopsies, particularly when the mass was located in the upper part of the small intestine or stomach. Surgical complications were reported in some cats and included anemia requiring transfusion, septic peritonitis, anorexia, chyloabdomen, a condition involving lymphatic fluid in the abdomen, and fecal incontinence. Histopathological examination confirmed the diagnosis of gastrointestinal eosinophilic sclerosing fibroplasia in all 60 cats. In a notable percentage of cases, bacteria were observed within the lesions on histopathology, and in one case, fungal organisms were also detected. Further molecular testing identified various types of bacteria in some of the cases examined. Bacterial culture of tissue samples yielded a variety of common bacterial species. In a significant number of cats, biopsies were also taken from other organs, revealing evidence of gastrointestinal eosinophilic sclerosing fibroplasia in lymph nodes and the omentum in some instances. The cornerstone of treatment for most cats in this study was corticosteroid administration, with 98% receiving these medications, typically prednisolone given orally once daily. The median time to starting corticosteroids after initial presentation was approximately 3 weeks. The dose of prednisolone was often adjusted over time, and in some cats it was initially discontinued but had to be restarted due to a recurrence of clinical signs. The median time to reach the lowest effective maintenance dose of prednisolone was over a year, with the median lowest maintenance dose being 0.65 milligrams per kilogram of body weight per day. The most common complications associated with corticosteroid treatment were elevated triglyceride levels in the blood and the development of diabetes mellitus in a few cats. Secondary immunosuppressive medications, such as cyclosporin or chlorambucil, were used in some cats but were often discontinued. Antibiotics were also frequently prescribed, with penicillins and fluoroquinolones being the most commonly used. Dietary modifications with hydrolyzed or selected protein diets were recommended for some cats, with a portion of owners reporting improvement in their cat's clinical signs with these diets. Encouragingly, at the time of this study, a large majority of the cats, 88%, were still alive, making it impossible to calculate a median survival time. Of the cats that died or were euthanized, the reasons included poorly controlled gastrointestinal eosinophilic sclerosing fibroplasia in some, pancreatic cancer in others, and unknown causes in one case. Notably, there was no statistically significant difference in survival between cats that underwent surgical removal of the mass and those that only had a biopsy. Similarly, there was no significant difference in survival based on whether the surgical removal achieved complete margins or not. Furthermore, the use of secondary immunosuppressive agents or antibiotics did not significantly impact survival times. The findings of this large international study reinforce that gastrointestinal eosinophilic sclerosing fibroplasia is an important diagnostic consideration for cats presenting with abdominal masses. The locations of the masses observed in this study, most commonly in the small intestine, stomach, ileocolic junction or colon, and also involving lymph nodes and the mesentery, are consistent with previous reports. The frequent involvement of multiple sites within the same cat highlights the widespread nature this condition can sometimes take. The novel finding of a concurrent eosinophilic skin mass in one cat suggests that this disease may have the potential to affect locations beyond the abdominal cavity, although further research is needed to explore this. The median age of affected cats in this study aligns with previous findings. While earlier studies suggested a predisposition in male cats, this was not clearly demonstrated in this larger cohort. The significant representation of pedigree breeds, particularly ragdolls, exotic shorthairs, and Persians, strongly supports the idea of a genetic predisposition in certain feline lines. The researchers propose that these breeds may have an increased tendency to develop eosinophilic inflammation in response to substances within the intestines. It is also important to note that some of these breeds are also known to be more susceptible to feline infectious peritonitis, emphasizing the need to differentiate between these conditions in cats with abdominal masses. The clinical signs observed in this study were largely consistent with previous reports, although the frequency of a palpable abdominal mass was somewhat lower in this larger group of cats. The prevalence of fever was similar to earlier findings. The bloodwork abnormalities such as eosinophilia, anemia, low albumin, and elevated globulins were also generally in line with previous studies, although some differences in the frequency of these findings were noted. This study provides valuable insights into the abdominal ultrasound findings in cats with gastrointestinal eosinophilic sclerosing fibroplasia, a previously understudied area. The findings of mural thickening, loss or alteration of intestinal layering, and circumferential growth of masses originating primarily from the stomach or intestines are important for recognizing this condition through imaging. The frequent presence of enlarged local lymph nodes and peritoneal changes further aids in the diagnostic process. The detection of bacteria within the lesions in a subset of cases supports the potential role of bacteria in the development or progression of gastrointestinal eosinophilic sclerosing fibroplasia, although the exact nature of this association requires further investigation. The relatively low percentage of cases with identified bacteria in this study compared to some earlier reports may be due to limitations in the retrospective data, such as incomplete bacterial culture or molecular testing. The rare finding of fungal organisms in one case highlights the potential for other infectious agents to be involved. The high survival rate observed in this study underscores the importance of accurate diagnosis, as gastrointestinal eosinophilic sclerosing fibroplasia appears to have a much better prognosis than many of the neoplastic conditions it can mimic. The finding that the majority of cats were still alive at the time of writing suggests that with appropriate management, cats with this condition can have a good long-term outcome. While previous studies suggested that surgery followed by corticosteroids improved survival compared to surgery alone, the current study, where almost all cats received corticosteroids, could not directly assess this comparison. However, the lack of a statistically significant difference in survival between cats undergoing surgical resection and those undergoing biopsy alone, even including cases with complete surgical margins, suggests that medical management with corticosteroids plays a crucial role in the long-term outcome, regardless of the extent of surgical intervention. The apparent importance of corticosteroids in managing gastrointestinal eosinophilic sclerosing fibroplasia is further supported by the observation of recurring masses and clinical signs in cats where corticosteroid therapy was not initiated or was discontinued. The need for long-term, albeit often at a low-maintenance dose, of prednisolone in many cats to control clinical signs is also evident from this study. The use of additional immunosuppressive agents or antibiotics did not appear to significantly impact survival in this cohort of cats, suggesting that corticosteroids are the primary medical therapy. The reported improvement in clinical signs in some cats treated with hydrolyzed or selected protein diets, while they were also receiving corticosteroids, suggests that dietary management may play a supportive role in managing this condition. In conclusion, this comprehensive study provides valuable insights into the clinical presentation, diagnostic features, treatment, and outcome of gastrointestinal eosinophilic sclerosing fibroplasia in a large cohort of cats. The findings emphasize the importance of considering this condition as a differential diagnosis for abdominal masses in cats, particularly in predisposed breeds like ragdolls, exotic shorthairs, and Persians. The study highlights the crucial role of corticosteroid therapy in achieving favorable long-term outcomes and suggests that extensive surgical resection may not always be necessary. Further research is warranted to elucidate the underlying causes of this disease and to optimize treatment strategies. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.